time to rethink how we handle hygiene in healthcare. Because there's social determinants can be contributed to, and that is why when you have conversations like we did in Davos at events like the World Economic Forum, people talk about ESG, environment, social, and governance. But when you talk about the social aspect, corporates need to contribute to those, as Klaus Schwab says, non-shareholding stakeholders or stakeholder capitalism, because they are your stakeholders. Directly, indirectly, they're your stakeholders. So if they are impacted, they're part of your broader communities, whether they're part of your business or not, you need to contribute. So this stage urgency is contributions from organizations and business, for-profit businesses and NGOs to support better nutrition, clean drinking water, teaching and actively supporting sanitary practices in school environments, in college environments, in low-income communities, actively doing so. Not sitting back and saying we're going to give out masks, because then they don't know what to do with the masks. We're giving out hand washes. The kids in the communities we've worked with in Mokalakwena and other areas around some of the mines didn't know what to do with hand wash. They didn't know what to do with wet wipes, because firstly, they didn't know how to open it. These are fundamental, simple skills that need to be taught. They didn't know that after handling animals or going to the bathroom, you shouldn't eat, because nobody told them why. They were told it's not good, but they didn't know why. But once we got involved in our training with those communities and started to inform them of what actually happens, what's an infective organism, what's a bacteria, what's a virus, or as they commonly say, what's a khoka, what's this bad thing that's going to make you sick, and how it actually goes in your body, and how it passes from hand to hand and hand to mouth and to poor bathroom practices and food and animals, it changed not just the dynamic of the kids, not just the dynamics of the schools, but it changed the dynamics of the communities. Because we had feedback from the parents who came back and said, our kids are telling us, don't eat till you wash your hands. Don't touch the food till you've washed your hands. These are simple practices that are not only effective in preventing I wouldn't say normal, but other infective practices or other infective organisms being passed on. But in this case, it's practically applicable for the coronavirus. It's the same best practices. Wipe your hands as often as you can. Keep them clean. Sanitize as often as you can. And that does not mean reach the point of OCD and paranoia where every time you touch someone's hand, you're wiping and you're not going to touch. But minimize personal contact. If not eradicate it, then handshakes are not necessary anymore at this point, because you're trying to limit those contacts and you don't know what contacts other people have had. It's not the person whose hand you're shaking, but the fifth person down the line that he met at a mall who met a friend that came from a potentially high-risk area. That you need to be cautious of. So these basic, simple practices of sanitizing. When you sneeze, don't sneeze into an open environment. Sneeze into your folded arm. Sneeze into a tissue or a handkerchief. Limit your contact with other individuals. Limit travel to high exposure environments. These are the fundamentals. And high exposure environments are not just airports. They include taxi ranks. They include bus stands. They include people waiting for taxis and bus stands. The long queues that you take at 4 in the morning to leave, and I know some of my staff that leave what is now known as Rifense, which used to be called Stinkvater, outside of Hammanskraal. They wake up at 3 a.m. They're already poorly rested. We've provided as much support as we can, but some choose to travel. When they wake up at 3 a.m. to get in that queue at 4:30 to make sure they work at 7:30, those are the risks. Because it's not that they're immune compromised. It's not that they have chronic health illnesses. These are people in their 20s and their 30s, but they're poorly rested. The bodies are under strain. They have social stresses of low income, stresses and strains on their income, what we call in South Africa as a popular phrase is black tax, which I think most people of color and across color lines experience, irrelevant of what color you are. You have a economy that's now in recession, like most countries are experiencing. You have strained incomes, lower incomes or average incomes and higher costs of living, and you have high stress on your body. That reduces your immunity to a large extent. So whether you're standing in line for a taxi, or you're the taxi driver, or you're a kid that's waiting to get a taxi, or you're going to walk to school, or you're a healthcare practitioner, everyone's at risk, but the basic practices are necessary.